According to the U.S. Department of Labor, there are over 100,000 vacant positions in the healthcare field. And by 2020, they predict there will be a shortage of 800,000 nurses. Tab O'Neill talked with Cindy Cole at Southern Virginia Higher Education about their state-of-the-art nursing center.
We have multiple programs that we offer here. We offer simulations for RN students, LPN students. We have CNA classes that are offered here. ODU comes and utilizes our facility sometimes. Halifax Regional Health System comes and offers classes here at our facility. They offer cardiac life support classes here, pediatric advanced life support classes here, and then sometimes our other healthcare partners will come and offer classes here, such as EMS classes.
Now, these classes that are being offered, are they, or could they be, because you have different partners, could they be part of a larger program leading to the registered nurse or whatever the case may be?
Yes. Mm-hmm.
Now, we have some students that are back here, and again, this is, I guess you're calling this gentleman Sim Man, who has a cough. And in this scenario, I think Sim Man is a COPD patient who has come in with difficulty breathing, I suppose?
Correct.
So they are simulating. Walk me through how this is working.
Okay, he came in with a COPD and he's having difficulty breathing. These students are entering in and he's coughing, so they're assessing his lung sounds. They're having to take his vital signs. And since he is having difficulty breathing, hopefully they will lift his head of the bed up so he can breathe better. They should notice that he has a lower oxygen level here shortly, and will put his O2 sats on his finger. Hopefully they will initiate some oxygen.
And I see that he has a little recorded voice. But the thing that impresses me most about this mannequin, it's actually indicating that his difficulty in breathing through the chest movement.
Yes, it does.
How does this benefit your students here at Southern Virginia Higher Education Center to have this available to them?
The hospital here is great at offering those students access to their facility, but there's so many students here that need the clinical experience, and there's not often spots available for the students. So the students can come here and can get simulation time in, and we can offer them experiences here in the facility at the CNE that they may not get a chance to do at the hospital or in the clinical areas.
Now, we've got, of course, some other simulations throughout the room here, other mannequins, we should say. We have a woman here who will actually give birth, and then you've got is it the Sim Newbie that you have here?
Mm-hmm.
Tell me about Sim Newbie. This is actually very complex and lifelike simulation.
Yes, he is. He actually turns cyanotic, which will turn blue when he has a low oxygen level. He too can breathe. He has pulses. We can start IVs in this baby also. We can intubate this baby just like we would a newborn baby that's having difficulty breathing. We can do CPR on this baby also.
One of the things that I can see as the greatest advantage of this is as you train medical care personnel, they've gone through these simulations, so when they're out there on the floor, wherever the scenario is they're working, I see it, I get it.
Right, exactly. And the best thing about it is they can come here and they can make a mistake, and it's okay. They can make that mistake here, and it's in a safe environment. No one's going to get hurt, and they can take the mistake and they can correct it here, and they can take it to the hospital, and they're going to learn from that mistake.
What is the best way for somebody to find out about your programs here at the Southern Virginia Higher Education Center?
They can call and talk to Barbara Perkins here at the Higher Ed Center, and she's able to tell them about all the various programs, the RN, the LPN program through Southside Virginia Community College, and then she's able to tell them about the programs with the CNA program at DCC.
Final question, and I think I know the answer to this. Medical care, good career?
Excellent career. Wouldn't trade it for anything.
And to find out more about the Southern Virginia Higher Education Center, call 1-800-283-0098 or svhed.org.